President, I've rarely been more excited to take my feet in this place than I am today to discuss the Children and Health Legislation Amendment, Statement of Recognition, Aboriginal Self-Determination and Other Matters Bill 2023. I think it's a really good bill. It's a bill, as I say, that I support and that we can support. We know in Victoria that far too many young Indigenous people are brought into the care system in the first place. Now, of course, in every individual circumstance, there is a reason for officers of the department to make those decisions. But my contention, the contention of so many Indigenous groups, has long been that what we need to be doing is to invest really heavily early in evidence-based early care and prevention models, not delivered by the government, but delivered by culturally appropriate organisations.
The Statement of Recognition in this bill recognises the impact of past policies on Aboriginal people and has been developed in collaboration with Aboriginal stakeholders, groups including the Victorian Aboriginal Childcare Agency and the Victorian Aboriginal Children and Young People's Alliance. It acknowledges the child protection system played a key role in the enactment of policies leading to the dispossession, colonisation and assimilation of Aboriginal people.
We do have an extraordinary number of people from Aboriginal families that are finding that their children are actually in care, and it is a great concern, and I am glad to know that the government is actually very concerned and prepared to look at this and address this issue.
Estimates by Deloitte Access Economics suggest that reforms to increase the out-of-home care leavers support age will halve homelessness, reduce hospitalisation by 1/3, reduce mental illness by 40%, increase engagement in education, significantly decrease arrests, and massively decrease alcohol and drug dependence. We commend the government on this bill and their work to ensure greater self-determination and culturally safe care.
The evidence really is clear that the single biggest factor in improving health and social outcomes for Aboriginal people is achieved through Aboriginal self-determination. The bill recognises a critical role connection to culture and family plays in development of Aboriginal children and in protecting them from harm, and that is recognised, understood and considered from the outset of engagement with the child protection system.
Aboriginal children are 22 times more likely than non-Aboriginal children to be in out-of-home care. In Victoria, we have the highest rate of First Nations children in out-of-home care, 103 per 1,000 children, double the national rate of 57.6 per 1,000. They make up more than 20% of children in Victoria's child protection system, an increase of 14.6% than in 2016. These new early intervention powers are designed to allow Aboriginal organisations to provide culturally appropriate, targeted support for families early in their contact with child and family services, and in turn reduce the number of children who are removed from their families and placed in the care of the system.